Let's start with biochemistry questions. Totally 50 questions were asked. 50 questions. So in exam, out of 300, 16 comes from biochemistry. I hope you had a fruitful lecture. And now let's continue with the test and discussion. The first topic I would like to discuss is fed-fast cycle. So we have a GLUT question. So GLUT type 1 is seen in RBCs. That is the question, right? So what are the GLUT types which we know? So GLUT type 1 is seen in RBCs. GLUT type 2 is seen in beta cells of pancreas. And what about type 3? Neurons. What about type 4? It is seen in heart, it is seen in adipocytes, and also in skeletal muscles. Type 5 is seen in the intestine, and also in sperm. So there are some important points. So type 1 and type 4 are insulin dependent. Okay, this is fructose transporter. 5 is fructose transporter, and beta cells of pancreas, they actually sense the glucose level and they release it. They facilitate the release of insulin. Okay, there are some other special types of GLUT, which is like GLUT 8 is for blastocyst, and then 6 is for spleen, and 7 is seen in some liver cells. These are some special types of GLUT, and there is also a special type of glucose transporter called SGLT. It transports with the secondary active transport, that is, it needs ATP, that is some sort of energy. So there are two types, SGLT1, SGLT2. SGLT1 is exclusively seen in the intestine, but SGLT2 is seen in, along with SGLT1 in the renal tubules. Okay, and there is a drug called SGLT2 inhibitors, which are your fluoresceins. What they have a side effect profile is UTI. Okay, they facilitate the release of glucose into the urine, thereby decreasing glucose level. Next is hormone in the well-fed state and covalent modification done by the hormone to the dependent enzymes to activate them. So what is a hormone in well-fed state? That is the question. So well-fed state hormone is insulin, and the enzymes activated is in the dephosphorylated. Just remember one combination. Well-fed state hormone is insulin, and the enzymes activated by it are active under dephosphorylated state. Opposite is starvation or fasting. Hormone is glucagon, and the enzymes activated is phosphorylated state. Okay, in fed-fast cycle, which of the following is not a metabolic fuel for brain in any state of fed-fast cycle? Okay, for brain. Okay, let's see some important points about the metabolic fuels. RBCs exclusively use glucose. Brain also exclusively use glucose, but some amount of ketone bodies it uses. Liver never uses ketone bodies. Never ever uses ketone bodies. Okay, these are some important things. And heart likes free fatty acids. Okay, so brain uses glucose and ketone bodies. Here glucose is there, ketone bodies is there, but free fatty acid is not there, therefore that is the answer. Next question, which of the following is active in fasting state? So in a fed state, which of the glucose is high? In a fasting state, glucose is low, right? So when glucose is low, we cannot synthesize fatty acid, cholesterol, or glycogen. We need to synthesize glucose. Therefore, we need to do gluconeogenesis. That's how you arrive at this answer. Next question, glycogen storage disorder. So you are a PDI intern, and in your posting you see a 7-month-old baby. It is getting a recombinant acid alpha glucosidase treatment. Okay, they have given the enzyme directly. So the patient looks weak and there is a massive cardiomegaly. So what type of disorder? So first let's see the glycogen storage disorder. There are 7 types, and the 7th type is actually TRUI. Okay, so here we can see alpha 1,4 glucosidase, which is Pompe's disorder. So this disorder is Pompe. Okay, so in this disorder, what is it? It is a glycogen storage disorder, but the answer is not glycogen storage disorder. because it is also a lysosomal storage disorder. Therefore, the answer is both. That is, Pompe is both a glycogen storage disorder and a lysosomal storage disorder. Another question: an infant presents with fasting hypoglycemia. The patient has hypoglycemia and hepatosplenomegaly. Liver biopsy shows limit dextrins. So, what is your diagnosis? So the answer would be Cory's disease. Anywhere we see limit dextrin, Cory's. So this could all be confusing, all the glycogen storage disorder. Is it that important to learn? Yes. They may ask you at least the important stuff you need to know. In von Gierke, this is a very important disorder. If you forget anything else, don't forget this disorder. The enzyme is G6Pase defect. The action of G6Pase is to convert G6P into G, that is glucose 6-phosphate to glucose. So if this fails, right, what happens first? What happens? The excess glucose 6P, it forms into two pathways. Okay, so it forms pyruvate. This pyruvate can go to lactic acid, or it can form acetyl CoA. This acetyl CoA can form ketone bodies and triacylglycerols. Okay. What about the other fate? It can enter into the HMP shunt pathway, leading to the formation of pentose sugar, which in turn form uric acid. So this is how the presentation occurs. So if you see, there is low glucose, so there is hypoglycemia. There is uric acid, hyperuricemia. There is lactic acid, lactosis. There is ketone body synthesis, ketosis. There is triacylglycerol, hyperlipidemia. So this is the entire presentation of von Gierke. If you remember this pathway, it is easier to memorize. And then next disorder is Pompe. And Pompe, when you learn Pompe, also learn the fifth one, McArdle. The main reason is because these both are muscles. Okay, Pompe causes cardiomegaly, McArdle myoglobinuria. That's it, simple. These are the clues. Here, if you want one single clue, learn this one, lactic acidosis. So von Gierke, learn the lactic acidosis. Pompe, learn the cardiomegaly. Just the clues, okay? These are not the actual clinchers, just a clue. For McArdle, learn the myoglobinuria. Okay, and what about these two? Branching enzyme is the and debranching enzyme. These three are the defects here. So if Cory's disease is the problem, then there will be a word there called limit dextrinosis. Okay, that is the debranching as defect. That is, the glycogen has been formed by forming branches, but now the branches are not there. So we have limit dextrinosis in the liver biopsy. It's a biopsy finding. Okay. What about okay, this is 4 is okay, branching enzyme is okay, and HERS is a very mild, they will give a mild form of disorder. With that you can diagnose HERS. Okay, this is the main clinchers. Just read these and then you will be okay. And then also hemolytic anemia, remember thyroid disease. For Anderson, okay, this is not a big deal. And then there is a second wind phenomenon in McArdle. Okay, these are glycogen storage disorder. If you find it hard, just learn these names and the numbers, and try to remember at least these 4 enzymes and these clinchers. Okay, these clinchers. That's it. Mucopolysaccharidosis. Mucopolysaccharidosis. Let's go to the next. Mucopolysaccharidosis, which is responsible for corneal transparency. Straight question, keratin sulfate. Just go ahead and mark it, no problem. And then mucopolysaccharidosis, no corneal clouding. No corneal clouding, that's important, okay? So only 2 disorders doesn't have corneal clouding, that is Hunter and Sanfilippo. You have to know this is very important. Hunter's doesn't have a corneal clouding. In mucopolysaccharidosis, the point is that Hunter's is an X-linked recessive disorder. Everything else is an autosomal recessive disorder. while hunter alone is an X-linked recessive disorder. Just remember this. And there are some important treatments which they have highlighted in mucopolysaccharidosis, such as for type 1, which is Hurler, the treatment is aldrazolam, and then for type 2, which is Hunter, the treatment is elaprase. Then for Mortiox Lamy, which is 6 is Naglazyme. The treatment is because it is novel. Usually in FMG exams, novel stuff come. So just try to remember this stuff. Inulin is a homopolysaccharide polymer of fructose. Direct question, easy question. Fructose. It is synthesized from flour. It is very bulky. It is used to calculate the renal function. All this you will learn in physiology. Okay. Rate limiting enzyme of glycogenolysis. Rate limiting, if in biochemistry any question you can get wrong except these. If you don't get these right, you have not prepared for the exam. Okay. So rate limiting enzyme, everything you should know. Glycogen phosphorylase is the rate limiting enzyme for glycogenolysis. This is the answer, the correct answer. What about others? Glycogen synthesis for glycogenesis. Okay, G6PD is for HMP pathway. It is the pentose sugar pathway. Isocitrate is for the Krebs cycle or a TCA cycle. Fluoride inhibits which enzyme? Fluoride inhibits enolase. Okay. What about the other substrates described here? What are their inhibitors? G3P dehydrogenase is inhibited by acetate. The acetate is iodoacetate. 1,3 BPG kinase is inhibited by arsenate. Succinate dehydrogenase is inhibited by fluoride inhibits which enzyme? Enolase. So what about others? G3P dehydrogenase, it is inhibited by iodoacetate. 1,3 BPG kinase is inhibited by arsenate. Succinate dehydrogenase, this is not a part. These three are glycolytic enzymes. This is a Krebs cycle enzyme, and the inhibitor of succinate dehydrogenase is malate. Okay, next. What is the most polar amino acid? The most polar amino acid is arginine. Okay. And what about among the aromatic, right? Among the aromatic amino acids, the polar one most is histidine, and the non-polar one, sorry, the least polar one, tyrosine. And generally, which is a non-polar, completely non-polar, is isoleucine. So most polar is arginine, non-polar is isoleucine. Among aromatics, histidine and tyrosine. Okay. So which of the following is a semi-essential? The semi-essential amino acid in this list is histidine. What are the other semi-essential? Arginine. And they're ketogenic, purely ketogenic. Okay, there are three fates actually. It is ketogenic or glucogenic or both. Purely ketogenic are leucine, lysine, and both glucogenic and ketogenic is PIT, like Brad Pitt, PIT. Phenylalanine, isoleucine, tyrosine and tryptophan. Everything else is glucogenic. Okay, just remember this list. And in a scientific experiment where mice pituitary glands are removed, that is, they remove the pituitary glands, which of the following hormone levels would drop significantly? So to understand this, you need to understand the synthesis of catecholamines, which is dopamine, norepinephrine, epinephrine. All this synthesis you have to understand. Among this, there is an enzyme called PNMT, which is supported by cortisol. Cortisol is in turn supported by pituitary gland, which is the enzyme ACTH, where ACTH supplies the adrenal gland and gives the cortisol, which promotes the PNMT and forms epinephrine. The epinephrine is exclusively formed in the adrenal medulla. The epinephrine is exclusively formed in the adrenal medulla. These norepinephrine or dopamine are also synthesized in some other sites of neurological origin, but epinephrine is exclusively in the adrenal medulla. Therefore, if we remove the pituitary, the cortisol support will go and epinephrine would be dropping. That is the answer. Okay. 5-month-old girl presents with hypoglycemia and failure to thrive. Okay. The uracil level is elevated and the patient went comatose. When administered the dextrose, the patient recovered. What is the enzyme defect? Okay. See the options. All the enzyme defects are similar to urea cycles and urea cycle defects. All right. So in this, we need to take a look at urea cycle. So this is the urea cycle. So the answer which is the answer for this question is the defect in ornithine transcarbamylase, which is the hyperammonemia type 2. Hyperammonemia type 2. Okay, hyperammonemia type 2 is the answer, and the enzyme defect is ornithine transcarbamylase. So whenever you see a urea cycle, whenever you see elevated ammonia levels or a urea cycle disorder, you should look for what are the elevated amino acids or elevated substances given in the blood. Here we know the uracil is elevated, which is a pyrimidine derivative. Okay, that is not a big deal. But what I am saying is, you need to look for the amino acids such as citrulline, organosuccinate, arginine, or ornithine. If citrulline is elevated, then the enzyme defect would be this enzyme. If organosuccinate is elevated, enzyme defect would be this one. If arginine is elevated, enzyme defect would be this one. And if this ornithine transporter is a problem, then this ornithine would be elevated. So based on this, we can identify which is the problematic enzyme. But here we can see ornithine transcarbamylase is elevated, which facilitates the fusion of CPS, the carbamyl phosphatase, phosphate and ornithine. If this is defective, what happens is this carbamyl phosphate moves out to cytosol, forms orotic acid, and it also enters into pyrimidine synthesis, the purine pyrimidine synthesis. No, it enters into the pyrimidine synthesis and forms uracil as the end product. This uracil and orotic acid accumulate in the blood, and orotic acid is seen in the urine. So if orotic acid is seen in the urine, we can easily put hyperammonemia type 2. I was specifically not given the answer, the clue here that orotic acid is seen in urine, because to make this question hard. Sometimes in FMG exam, you'll know the case, but you won't know the clincher, the point which you used to study. That won't be a problem, because one question will not make a big difference. But if you spend a lot of time wasting it in the question paper or in the time for other questions, what happens is you will lose 2 more questions. That will be detrimental in achieving the 150 or the 200 score which you are aiming. So if you don't have an important clincher and you're still not sure, just leave the question or go for a guess. Okay. So here I will, the answer is ornithine transcarbamylase. Enzyme defect in alkaptonuria, homogenticid oxidase. Direct question. In ammonia transport from other organs to liver using glutamate, where does the first line trapping occurs? So see, this is the reaction. That is the brain, whatever. They give ammonium or ammonia. It gets incorporated and glutamine is forming. This glutamine is the one entering into this pathway, urea cycle pathway, which forms the urea at the end of the day, and it is released. Okay, and it is excreted. So this is how ammonia is excreted. It is a toxic substance, and this first line trapping reaction is this one, where ammonia or ammonium is established into glutamine. Okay, so this happens in the cytosol. Okay, this happens in the cytosol. Sphingolipids. Okay, these are important diseases. They are stressed clinically, so therefore I framed one or two clinical questions. An 18-month-old baby with progressive worsening of neurological symptoms. Diagnosis such as WBC enzyme activity shows sphingomyelinase. Direct one-liner they have asked, what is the sphingomyelinase enzyme defect? Answer is Niemann-Pick. If they had given such a clinical question and they have given us one-liner also, then it is not even a big question. You just to find the clincher and go for the kill. Answer is Niemann-Pick disorder. Okay, there are some important sphingolipidosis or the disorders which are associated with this, which you need to know the one-liner, just the enzyme defect and the name. Okay, so that include Gotcher, Niemann-Pick, Tay-Sachs, Sandhoff, Krabbe, Fabry. Krabbe and Fabry is rhyming. Sachs, Sand, almost rhyming. Okay. And Gotcher, Niemann-Pick. These two are more familiar names, right? Maybe for me it is so. Okay. For Gotcher, it is glucocerebrosidase. Okay. And for Niemann-Pick, it is sphingomyelinase. So these two are obsoletes. You have to remember these no matter what. These are very important. And Tay-Sachs and Sandhoff, it is beta hexosaminidase. Both are same name. Tay-Sachs is A and Sandhoff is B. Cannot remember, Tay-Sachs has 2A, Sandhoff is only 1A, so give Tay-Sachs the award of A. Beta hexosaminidase, A is Tay-Sachs, Sandhoff is B. Krabbe Fabry, very rhyming, no? So these both are galactosidase. Krabbe is alpha, Krabbe is beta, Fabry is alpha. F comes first, so give alpha. Krabbe K comes second, next to F, so beta. Krabbe Fabry, beta galactosidase, Fabry is alpha. There are some other important stuff like Ullmann's or Farber's. For example, Farber's is ceramidase and Ullmann's is acid lipase, I guess. But these things are not important. Just remember these six, which are very important and asked and tested in exams. Okay. And Gotcher clinical examination is also important. I think next question is. I think we have one more question from Gotcher. I will show you at that time. Okay, a 30-year-old male presenting with small collections of yellow papules in elbows and knees and orange-yellow discoloration of palmar creases. All right. So, what is the defect associated with this disease? So, we can see that this is called as palmar xanthoma. These are xanthomas. This is also a xanthoma. So, this is? I think this name is a tuboeruptive xanthoma. Okay. So, the disorder here is a familial beta lipoproteinemia. So what we are going to do is find the mutation. You just should have studied this before, otherwise you would have got it wrong. But see, hyperlipoproteinemia questions or anything disorders related to lipid metabolism is tested almost in every exams. So try to just know the basic cause of the defect and name of the defect, and just a few clinchers like these, yellow discoloration, something like that. Very important one only. I will just explain other options. They are not that important, just obsolete. They are not very important. Just you can just note down. B100 defect is ADH type 2. PCSK9 will be ADH type 3, and ApoAV is type 4. Hyperlipoproteinemia also implicated in type 5 also. Hyperlipoproteinemia type 1, type 4, type 5, these three are classified by a Frederick classification. That is not very important. But know this one, ApoE mutation, Palmer xanthoma, familial beta lipoproteinemia. That is the important question. That's why I took this question. And regulatory step in cholesterol synthesis, HMG CoA reductase. Actuator of LCAT. Okay, this may seem like Greek and Latin if you had not studied this, but LCAT, the function of LCAT is very important in HDL. We would have studied previously that HDL is good cholesterol and LDL is the bad cholesterol, but things are changing pretty seriously. Like LDL is not regarded as bad cholesterol anymore. The world has stopped seeing LDL as the culprit. But HDL has arrived at a diagnostic point of view. For example, there are many criteria which take HDL level. That is, if HDL drops and LDL increases, the HDL dropping is more diagnostic value than LDL. So HDL is receiving more love than LDL. Okay, so you have to understand some points related to HDL. So in HDL, LCAT is activated, and ApoA1 is the activator. What this ApoA1 does is, okay, this one, okay, 40-year-old female, bleeding history, pancytopenia, leg pain. There is an Erlenmeyer deformity, and bone marrow biopsy shows the finding. So what is this finding? This is the crumbled tissue paper appearance. So this is the Gaucher's disease. I have already told the defect of Gaucher's disease, and this is the crumbled tissue paper appearance, and Erlenmeyer deformity can also be asked. Chaperone's assistant, protein folding, direct question, no confusion. Chaperone's assistant, protein folding. DNA polymerase 1, okay. Okazaki fragment synthesis, okay, true point. Okazaki fragment synthesis is done by polymerase 3. Synthesis of RNA primer is done by primase, or maybe guidase, okay. Primary enzyme of DNA synthesis is polymerase 3, obviously. So, found in prokaryotes is DNA polymerase 1, that is the correct answer. So, see, this is what happens. So this is the leading strand. Polymerase 3 synthesizing here, polymerase 3 synthesizing here, primase is synthesizing the primer, and there is a replication fork. This is the replication, that is the unwinding happens here, and to prevent the unwinding, there is a single cell binding protein, and helicase is the unwinder. Okay. And where is the DNA polymerase? DNA polymerase is here. What it does is it removes the primer, and it fills up the DNA. That is, it does a repair and fills the DNA. And finally, the ligase will connect it. Okay, this is the role of polymerase 1. It is not a synthesizer completely, it just repairs. Okay. Next question. 7-year-old male, self-mutilation with biting. So the answer would be Leishnihan. The clincher is biting, so just go for Leishnihan, and enzyme defect is HGPRTase. Organelles of pyrimidine synthesis. Pyrimidine synthesis is synthesized into organelles, cytoplasm and mitochondria. This is the answer. Pyrimidine synthesis is not an important process to completely memorize, whereas purine synthesis you should memorize. And salvage is not important, but degradation, that is the breakdown of purine and pyrimidine, just to go through that. But pyrimidine synthesis, just know where it happens, that it would be enough. Cytoplasm and mitochondria. Physiologically stabler DNA is bDNA. zDNA is zigzag DNA. Heterochromatin. I think the question would have come as true statement on heterochromatin. A transcriptionally active and a less condensed and a less densely stained chromatin would be euchromatin. And the high MEC content is the answer for heterochromatin. Obviously, you may not remember this, but these three are easy to remember. I'll show you the image. So this is a euchromatin. What happens is, normally it is stored in this way, and then it gets unwind. It is less condensed, so it stains less, and it can transcriptionally, these parts can transcriptionally active, but this cannot be active. Okay, this is euchromatin. HNPCC is associated with mismatch repair. What about others? Base excision repair. Base excision repair causes muti. Nucleotide excision repair leads to xeroderma pigmentosa. And some special disorders like cocaine syndrome, and some hair trichothiodystrophy. Okay. But important is xeroderma pigmentosa, nucleotide excision repair, mismatch repair is HNPCC. These two are very important. Northern blot. In north they eat roti, so go for RNA. In south we eat dosai. If they are southern blot, put DNA. Helicase. Obviously helicase site of action, it unwinds, so here the unwinder is seen in E, so answer is E. HbA1c is measured best. This is a previous question, repeat question. The answer is ion exchange chromatography. That is the technique we use currently. Few of us marked as affinity chromatography, but this is the right answer. Okay, ion exchange chromatography. Aldolase belongs to which enzyme class? Direct question. Lyase. What is a lyase? Lyase is the one which can split a molecule without using water. That is, it does not use water. So aldolase does not use water. So it falls under LIS. First enzyme to rise in cardiac biomarker. This is a twisted question. It may sound controversial to you. Few people say, well, myoglobin, few people say creatine kinase. The point is, it is an enzyme. The question is an enzyme. Myoglobin is not an enzyme, whereas creatine kinase is, there is kinase, right? So it is obviously an enzyme. So therefore CKMB is the answer. But if they ask simply which biomarker rises first, then you can go for myoglobin. But which is more clinically used, it is cardiac troponins. And CKMB can be used to detect reinfarctions. That is an internal medicine question. It could be too advanced for you right now, but still you would have all studied internal medicine in college, right? So reinfarction, CKMB can be used for diagnosis. Vitamin A type has functional role in vision. The answer would be 11-cis retinal. This isotope has the isomer has the problem, has the function to detect vision. So how it happens is, there is 11-cis retinal. From retinol it forms into retinal, and opsin, when an opsin is added, it forms a rhodopsin. Okay, when light is given, that is H news photon, when light is given, it forms meta-rhodopsin, and it undergoes a full cycle, and then it comes back to cis retinal, where this entire thing happens in the retinal pigment epithelium, that is in retina. So, and then based by this action, what happens is the electrical impulse is transferred and light is sensed. This is how light is sensed, and the main junction pathway is 11-cis retinal. So therefore this is the answer. Major substrate for vitamin D synthesis is 7-dehydrocholesterol. In sunlight we get vitamin D. Even laymen know that, but the substrate is 7-dehydrocholesterol. I think many would have got this answer right. Cholecalciferol is other name for vitamin D, so it is not a substrate. If you mark that, it means you are not reading the questions properly. Site of action of vitamin D in kidneys. Again, vitamin D question, answer is distal tubules. Vitamin D can act in bones, can act in kidney, and it acts in and also act in intestines. It tries to increase the calcium levels. So in distal tubules, it increases the reabsorption. Deficient in breast milk. Okay, so basically vitamin D and vitamin K are deficient in breast milk. So in a baby, vitamins are defective, and when K is defective, it could lead to hemorrhage and so many other problems. Therefore what happens is, vitamin K injection we give immediately upon birth, right? And what about D? D deficiency can happen because the breast milk will also not be there, and the baby, they would have covered fully and no exposure to sunlight. So vitamin D deficiency could occur, and even vitamin A is low in babies, but A is rich in breast milk, so it will be immediately replaced. Okay, so answer will be D and K. A newborn was diagnosed with maple syrup urine disease. Which of the following vitamins is a cofactor for the defective enzyme? So what is the defective enzyme for MSUD? It is a branched chain alpha ketoacid dehydrogenase. So the enzyme is BC alpha KD, and the cofactor is thiamine. Okay. Carboxylase reactions. All carboxylase reactions will have biotin. There are some carboxylase reactions without biotin, also there are exceptions, but if the question asks generally, carboxylase will usually have biotin. Okay. Biotin is B7. An elderly patient with subperiosteal hematoma and painful gums. So diagnosis is scurvy, gums. Subperiosteal, obviously go for scurvy. So deficient vitamin would be C. Dilated cardiomyopathy, alcoholic. Whenever you see dilated cardiomyopathy, go for an alcoholic, and he has an increased fatigue and lower extremity edema with poor sensation in ankles and feet. So there is neuropathy also. So what is the most likely presentation? In alcoholics, B12 absorption will drop, and neuropathy is also a B12 deficiency symptom. So go for B12 deficiency. Collagen synthesis, vitamin C. That's why we are using vitamin C serum in dermatology products these days now. So because they increase the collagen, so the wrinkles will not happen. Okay. Most potent antioxidant, vitamin E, also now abused so many because it has a very anti-lipid nature, and a very and it is also a most potent antioxidant. So therefore it is being used a lot these days, vitamin E. Erythrocyte glutathione reductase assay. It is a 1 mark, one liner. If you had known, you would have marked it B2. I don't think they would apply this clinically, but still I thought it is important to know, or at least you should understand that no matter how much good you study vitamins, there will be one or two questions you may not know. In a population eating maize as staple diet, which vitamin deficiency is risked more? So this was a repeat question from NEET. So if you eat maize, right, what happens is the leucine is high, and this leads to an enzyme called QPRTase inhibition. This will cause niacin deficiency. Okay, so spina bifida is a what is that? Neural tube defect. So this neural tube defect will be due to folic acid, vitamin B9. That's why we are supplementing mothers with folic acid. Intrinsic factor of Castle, which is used in B12 absorption. So it is secreted by parietal cells. The presentation with alopecia, hepatotoxicity, nausea and vomiting, dizziness and blurred vision is associated with. Okay, we have to rule out here. Vitamin B12, you would have some neuropathy problems, but it's not there. Vitamin E deficiency would present like vitamin K. There is no clotting or any problems. Vitamin B6 or vitamin A toxicity. You have to understand that this is vitamin A toxicity, because vitamin B6 will also present like neuro, maybe with convulsions or some severe neuro problems. Okay, but the problem here is vitamin A toxicity. How we can say is that there are two types of vitamin toxicity. It could either be acute or chronic. You may get confused how someone may have acute vitamin A deficiency. In polar bear, in liver, livers of polar bear, vitamin A is stored in excess amounts. Okay. Even in our liver, vitamin A is stored in ETO cells. What happens is when Arctic explorers go to Arctic areas and they eat polar bear, and they have polar bear liver is very tasty. So if they eat that a lot, they get vitamin A toxicity, and they present as pseudotumor cerebri, where they get this nausea, vomiting, headache, papilledema, something like that, and hepatotoxicity and everything. And important topics in biochemistry: vitamins, rate limiting enzymes, clinical questions, learn the treatment, clinches and defects, fed-fast cycle, and in DNA, read Charkov role, purine pyrimidines, and also read the polymerase. Thank you. Please comment your feedback.